Hi, I'm just washing my hands here to reduce the risk of infection.
Okay.
I'm Destiny Barnes. I'm going to be your nurse today.
Nice to meet you.
Okay. Can you tell me your full name and date of birth?
Jane Doe 118093.
Okay, Miss Doe. So today we're going to do a full head-to-toe assessment. I'm going to ask you some questions. I want to assure you that everything we talk about is confidential and I will maintain your privacy.
Okay.
If at any time you have any questions, please feel free to ask me.
Yes,
It should take about 20 minutes or so. Is that okay with you?
Yes, ma'am.
Okay, great. So before we move forward, I'm going to tell you 4 words.
Okay.
And I want you to remember them for later on.
Okay.
The first word is puppy.
Okay.
The second word is cheeseburger.
Okay.
The third word is pencil.
Okay.
And the fourth word is sunflower.
Okay. Puppy, cheeseburger, pencil, and sunflower.
Yes. Okay. So first I want to ask you, do you know where you're at?
A UALR library.
Okay, and if you were lost somewhere, could you call someone and describe where you are?
Yes, ma'am. Just off a university at UALR campus library.
Okay, great. Could you name 5 states for me?
Yeah. Tennessee, Kentucky, Florida, Georgia, Alabama.
Okay, and what is 5 times 3?
15.
Okay. I'm going to hand you this pen in your right hand, and can
Okay.
you draw a heart?
Yes.
And then move the pen to your left hand and place on the table when you are done. Okay, great. So how was your mood lately?
I feel really good.
Okay, are you having trouble sleeping?
No, ma'am.
Do you have any thoughts of harming yourself or somebody else?
No, ma'am.
Okay, and do you feel safe at home?
Yes, ma'am.
Okay, so can you tell me what those 4 words were?
Yeah. Puppy, pencil, sunflower, and cheeseburger.
Okay, great. You are cleanly dressed, you're appropriate dressed for age, you're smiling at appropriate times, your mood is good, your affect is within normal limits. Okay, great. So I'm gonna go ahead and just go over your vitals.
Okay.
Your vitals all were within normal limits. Your
Okay.
blood pressure was 121/71. Your heart rate was 72 with a regular rhythm. Your temperature was 98.1, and your respirations were 14. Does that sound about with your baseline?
Yes, ma'am.
Okay, and are you in pain today?
No, ma'am.
Okay, if you had to rate it 0 to 10, what would you say?
A 0.
Okay, great. All right, so I'm gonna go ahead and look at your skin here.
Okay.
I'm just gonna assess for any lumps, lesions, or bruises. You have some tattoos, I see,
Yes, ma'am.
and you have a facial nose piercing.
Yes, ma'am.
Do you have any concerns about your skin?
No,
any moles or anything?
No, ma'am.
Okay, great. All right, so I'm gonna go ahead and check your fingers here.
Okay.
And your cap refill is within 3 seconds. There's no clubbing of the fingers. It all looks within normal limits. I'm gonna check your toes.
Okay.
And your cap refill is within 3 seconds. There's no clubbing of the toes. Do you have any concerns with your nails or anything?
No, ma'am.
Okay, great. I'm gonna go ahead and have you put your arms out.
Okay.
And I want you to push up against my hands. Okay, and push down.
Okay.
Okay, and can you grip my fingers? Okay, great. And do you feel my hands running
Yes,
down?
ma'am.
Do you have any tingling or tenderness
No,
or
ma'am.
numbness? Okay. Do you feel my hands?
Yes, ma'am.
Okay. I'm gonna have you stick your legs out and push up against my hand and push down. Okay, great. And now I'm gonna check your pulses here. So your posterior tibial is present and bounding. Your pedal pulses are present and bounding. Your radial pulses are present and bounding, and your brachial pulses are present and bounding. Do you have any numbness or tingling in your toes?
No, ma'am.
Okay, great. Your skin was also warm and dry to the touch.
Okay.
You don't feel warm or seem to have a temperature.
Okay.
All right, so your head is round, normal cephalic with the body. It is midline. Your hair is dry, your hair in red color. No lesions or parasites present. Your eyes are normal and symmetrical with your midline. Your trachea is midline. And okay, so I'm gonna have you close your eyes.
Okay.
And I'm gonna touch your cheeks, and I just want you to tell me
Left.
which side.
Right. Left. Right. Right. Left.
Okay, and can you open your eyes and raise your eyebrows really big and your teeth really big? Okay, there's no facial drooping, your face is symmetrical. Can you puff out your cheeks? Okay, and bring back. Okay, great. Your facial nerve is great, all within normal limits. And your trigeminal nerve is all within normal limits.
Okay.
Okay, so in your eyes, I'm gonna just assess your eyes real quick. I just want
Okay.
you to look past me. Okay, eyes are equal and reactive to light. Your eye color is brown. There's no drainage present. I'm gonna have you look up, please. Your conjunctiva is pink and your sclera is white. Your eyelashes are facing outward, evenly distributed. Do you have any concerns with your eyes?
No, ma'am.
Do you wear contacts or glasses?
Contacts.
Okay. All right, so I'm gonna have you hold this paper here.
Okay.
Cover one eye and just look 20 feet past me.
Okay.
Can you describe what you see?
Red brick wall.
Okay. No, the other eye.
Red brick wall.
Okay, great. All right. So I'm gonna have you look at my finger
Okay.
and then look past me and come back to my finger.
Okay.
Okay, great. Now I'm gonna have you just follow my finger with your eyes. If you feel any pain, just let me know. Okay, great. Awesome. Your accommodation is present and it looks good. Your optic nerve, your ocular motor nerve, your trochlear nerve, and your abductance nerve are all within normal limits.
Okay.
Okay, now your ears. They are symmetrical with your eyes, which is good. I'm just gonna assess for any drainage.
Okay.
And I don't see anything. Your recoil is immediate. Do you have any pain?
No, ma'am.
Okay, if I were to have an otoscope, I would look in your ears and I would see your tympanic membrane.
Okay.
It'll be shiny, reflective to light, and a light gray color.
Okay.
It should also be concave.
Okay.
Okay, I'm gonna cover one ear and I'm gonna whisper a word in your
Okay.
ear and I just want you to repeat it, okay?
Okay. Money.
Okay.
Baby.
Okay. Great. Now, so that is testing your vestibular nerve. And if I had a candle, I would have you smell it and you would describe what it is to
Okay.
test your olfactory nerve, okay?
Yes, ma'am.
All right, so for your nose, I'm gonna have you cover one nose,
Okay.
nostril, and then breathe in and out. And the other side. Okay, great. So there is no occlusions. I'm gonna just look up in your nose here. Go ahead and tilt up. The septum is midline, nose is midline. There's no deviation. I'm gonna press slightly. Do
Okay.
you feel any pain or tenderness?
No, ma'am.
Okay, and I'm gonna check your sinuses here.
Okay.
Do you feel any pain or tenderness?
No, ma'am.
Okay, great. So we checked your olfactory and you were able to breathe out of both sides.
Okay.
All right, so I'm gonna look at your mouth now and open big, stick out your tongue, put it up. Okay, great. The lips are symmetrical. All teeth are present. Your buccal mucosa is pink and moist. You had saliva in your mouth. Your tongue is pink. Your uvula is midline.
Okay.
Can I have you swallow? Okay. Swallowing reflex is present. And that is testing your glossopharyngeal and your hypoglossal with your tongue sticking out, which was good.
Okay.
Okay, so we're gonna move on to your neck now. I'm just gonna assess your neck.
Okay.
Skin tone is within normal limits. There's no facial hair or lesions present, no bulging. And then I'm gonna have you look all the way down and all the way up, all the way to the right, and all the way to the left. Okay, so your spinal accessory nerve is great. And I'm gonna palpate your lymph nodes.
Okay.
So your preocular, your posterior ocular,
Okay.
your occipital, your submental,
Okay.
your submandibular,
Okay.
your tonsillar,
Okay.
your superficial cervical, and your deep cervical chain, one at a time, and then your posterior cervical, and your supraclavicular lymph nodes. No lymph nodes are palpable, which is
Okay.
great. And I'm gonna go ahead and listen to your carotid here.
Okay.
palpate. Okay. All right, and I'm gonna have you hold your breath. Okay. And I'm gonna do the other side. You can take a breath and then hold it. Okay. Your carotid is strong and equal with regular rhythm bilaterally. There's no bruits that would indicate arterial occlusion that could lead to a stroke. Okay, so that looked really good. Okay, so now I'm gonna go ahead and move on to your lungs now, okay? I'm just gonna palpate.
Okay.
And do you have any tenderness or soreness?
No, ma'am.
Do you have pain when you breathe in and out?
No, ma'am.
Okay, so I'm gonna listen to your lungs. Okay, go ahead and take a deep breath. Okay, and your back. Okay, and I'm gonna have you raise your arms and same thing, just take a deep breath in and out. Okay, great. So your lungs sounds clear, anterior, posterior, and laterally. There is no adventitious sounds present. And I'm gonna just look at your spine here. Do you have any pain with that?
No, ma'am.
Okay, so your spine is midline in S shape. And I'm gonna just check your skin.
Okay.
There is no tenting present, which is great. Okay, so I'm gonna have you do a self breast exam, okay? So what we're gonna do first is I'm gonna have you place your hand up above your head, and you can do a rounding motion around your breast. You can do a sweeping motion or an in and out motion, and just assess your breast, feeling for any masses or lumps or dimples.
Okay.
And then you're gonna move into your armpit area. You're gonna feel your anterior, your posterior, your central, and your lateral lymph nodes. And then we're gonna move on to the other side here. And you're just gonna feel, and if you have any tenderness, redness, lumps, bumps that shouldn't be there, just let us know. While you're doing this, I also want you to know that you can do it sitting up as we did, or hand on your hips, and then lying down with your hands on your side. And if you squeeze your nipples, do you have any discharge?
No,
Are your areolas equal and of a different shade than your normal skin tone? Okay. Do you have any questions or concerns?
No, ma'am, not at this time.
Okay, well, great. Thank you so much. It was nice to meet you.
Have a great day.
You too.